If you've been following me, you know that almost 4 months ago I reported that if you have one bathroom in your home and you or worse, your child tests positive for COVID, they will remove your child from your home. I got this information from a Ventura County, California health director who let it slip back in early May, and I happened to catch it and post both the video and transcript on May 12th. I've included that post and the short 3-minute video for your review here. By the way, I have that video. I will play that video for you so you can see for yourself the plans to forcibly remove people from their homes. Now we learn where they are going to take children when they remove them from your home. FEMA concentration camp set up right here in Ohio. The hardest working journalist in Ohio, Jack Windsor, has reported this important information. The article states August 31st on an Ohio order created federal emergency management shelters and legalizing their use for people who are unable to safely self-quarantine in their place of residence and to isolate those diagnosed with or showing symptoms of COVID-19. I want to bring to your attention that Washington State actually has written into law that they can remove you from your home, take you to a quarantine center, not tell you where they're taking you, and not tell anyone else. No family, nothing. So they can just take you away and not tell anyone. Sounds kind of Gestapo-ish to me, like Secret Service showing up at the night, taking you away, never to be seen again. We also learned on Thursday that Mike DeWayne, who's the governor, announced in another new order that all K-12 schools are mandated to report COVID-positive test results from students. Are the schools being used to report positive COVID cases so that your child may be removed from the home based on mandatory school reporting? Again, I want to take you back 4 months ago where I stated in my reporting, they will find you and force you into isolation. They will remove you or a family member from your home, unquote. And I have that video. I will play it for you so you can see it for yourself. That may have all seemed like a conspiracy theory back then, but here we are. They told us what they were going to do, and these articles and the new Ohio orders connect the dots. Click the link and listen carefully in 20 seconds. Then read the article. Lastly, I ask you this question: are our schools, teachers, faculty, and staff being used as a means to test our children and have them removed from our homes? It's not good. Excuse me, it's not good. So let's watch that video. This is what Ventura County said a few months ago. We have the video. Listen closely.
We are beginning a program today, and it's a pilot program which will certainly grow into something larger and larger, and that is a community contact tracing program. We've done contact tracing all along. That a contact is a person who's been exposed to someone that we document to have the COVID infection. When we find someone who has a COVID infection, those people are immediately isolated. But we also work with them to figure out who their contacts were. Luckily, because you have been doing such a great job of cooperating and staying indoors, staying isolated, it used to be there were 10 contacts, at least, for every patient that we would find. Now, it looks like there are probably only 2 or 3 or 4 contacts, not surprisingly, because most people have been staying away from others. And that's good news. But the purpose of this program is to bring on people. We're going to start with 10 people. We may bring on up to 50 or even more as the program grows and as we see the needs for it. As we do more testing, we will find more and more people who have COVID-19. And again, we'll isolate every one of them, and we will find every one of their contacts, and we will make sure that they stay quarantined, and we'll check in with them every day. In other words, what this program means is that we're going to do a more complete job, and we're going to do a more meticulous job of making it less and less possible for others in the county to run into someone with COVID-19 infection. it's not just our county that's bringing more people on. There are going to be thousands of people hired who will be these contact investigators throughout the state. And this is occurring in many, many other states as well, perhaps all of the states in our country. We will be giving intensive training to these people, training not only for identifying and finding contacts, but also in terms of how to be sensitive about doing it. We also realize that as we find more contacts, some of the people we find are going to have trouble being isolated. For instance, if they live in a home where there's only one bathroom and there are 3 or 4 other people living there and those people don't have COVID infection, we're not going to be able to keep the person in that home. Every person who we're isolating, for instance, needs to have their own bathroom. And so we'll be moving people like this into other kinds of housing that we have available. They'll also have other needs, perhaps, food, whatever it's going to be. The county will be there to back them up and to support them.
And our economy. Built in Ireland by the RockU Group, the system uses the very best COVID-19 testing, combined with the latest mobile technologies. Health Passport Ireland is powered by proven and validated systems, allowing us all to take safer steps in our return to our normal way of life. Here's how it works. With Health Passport Ireland, everyone can now be tested for COVID-19 at any time, which helps to protect you, your family, our jobs and our economy. Your COVID-19 test will be performed with highly accurate serological or swab tests. Your test is performed by a medical professional. After your COVID-19 test, an authorised healthcare administrator creates your Health Passport Ireland account. Your login details will be emailed to you immediately with a link to download your Health Passport mobile app. The authorised healthcare administrator securely updates your COVID-19 test results in your Health Passport. Once activated, you can easily display your COVID-19 status on your mobile. Your Health Passport can be scanned if you wish, which helps protect those around us. Your COVID-19 status will efficiently display as green, amber or red, dependent on your test results. This allows us to go about our daily activities in a safer way. We can all use Health Passport Ireland in many ways, such as travel, hospitality, education, healthcare, construction, offices, entertainment, visits and much, much more. Naturally, the validity of your COVID-19 test will expire over time, so an automatic reminder will be sent when it's time to be tested again. Your status will move to amber when your test period has expired. Health Passport Ireland does not use Bluetooth or track your location. This preserves your privacy. The systems can work in harmony with existing government contact tracing apps. When a vaccine becomes available, your official vaccination status can also be displayed within your Health Passport. You can even keep a diary of your international travel and events you have attended. Health Passport Ireland can be linked to existing secure medical systems if required, for example at your GP or hospital. You can visit www.healthpassportireland.ie for more information. Health Passport Ireland, working together to protect our society and economy.